I'm Diane Rosati, Executive Director of Bucks County Drug and Alcohol Commission. So we oversee prevention, intervention, treatment, and recovery support programs for Bucks County residents. But today I'd like to speak with you a bit about the opiate epidemic and the impact on Bucks County. Beginning with the theme, addiction can happen to anyone. Anyone in any community in the United States, in Pennsylvania, certainly in Bucks County. And as we sit today in Neshaminy School District, we know that Neshaminy is not alone. Every district in Bucks County is experiencing the opiate effects. And everyone can do something about this, from parents to students to grandparents to community members. Though I represent a form of county government, we know that county government cannot do this alone, nor can business, nor can the faith community, nor can individuals. It really takes a community effort. So one thing that we know that parents can do is begin to educate their children. Begin to educate them differently in that if, for example, a parent knows that a child is at risk of a medical condition, for example, like diabetes, the parent might direct the child to really watch what they eat so that they can prevent perhaps the onset of that disease. We're treating substance use disorders much the same way, and that is that if parents know that there's a family member who has a substance use disorder, we want parents to be able to openly and honestly discuss that with children so that they know potentially that they're at risk for a substance use disorder. And beginning that conversation is so very important. We know that parents and community members have control over the medications in their home, as another example, and everyone in the community can get rid of their unused, unwanted, expired medications. In Bucks County, we understand that as we're #1 in medications collected throughout the county. Neshaminy School District, for example, has many drop locations that individuals can go on a daily basis to get rid of their unused medications, because we know that youth most often begin their medication use from diverted medications in the home. And for community members, that goes as well for folks who are selling their home, who are involved with realtors who may have open houses, cleaners in the home, other workers who are in and out of the home. Lock up your medications if you need them, get rid of them if you don't. And for parents who believe that their child is using a substance and is just refusing treatment, there is help available, and that is called Act 53. Act 53 helps parents who want to ensure that their child is safe and has access to treatment through an involuntary commitment process. In Bucks County, we have a very streamlined and rapid process for Act 53 commitment, and that is through our agency, through the Bucks County Drug and Alcohol Commission. Folks can call our office at 215-773-9313, and one of our clinical staff will help parents to understand what the involuntary commitment process is, what's entailed, and how long it takes. It generally just takes about a week or so. It's certainly not the first step that we want to help parents with, but it really is an ultimate step when the parent is sure that the child is using a substance and the child refuses treatment. So we'll be happy to walk parents through that process. But before you get to that process, we want to ensure that you're taking advantage of the school-based programs that are occurring. Our office continues to fund the Student Assistance Program, certainly at Neshaminy School District, where the Student Assistance Program is very strong. Student Assistance Program, or SAP, is for identified at-risk youth, and our office provides through government funding, free of charge, an assessment for the child and referral to treatment if that's needed, and then continued monitoring. We would encourage parents, students, family members, anyone to refer a student confidentially to the Student Assistance Program through the NEST program at Neshaminy School District. And finally, if an individual in Bucks County is in need of substance use disorder treatment, we want them to get access to treatment as soon as possible, and for as long a period as possible. We know that individuals who are in recovery get the benefit of treatment the longer they stay. The longer someone stays in treatment, the better their chance at long-term recovery. So we have agencies throughout the county who offer what we call open access, meaning you don't have to make an appointment for treatment, for an assessment. You just walk into the assessment center, and locally in the Neshaminy area we have Aldi in Langhorne, Pyramid Healthcare in Bristol, Gadenzia, which is on the grounds of Lower Bucks Hospital, and in Doylestown, Aldi Counseling Center as well. Those are our local drug and alcohol walk-in centers where individuals can just walk in during the week as early in the day as possible for a free assessment if individuals don't have any form of insurance or if they have medical assistance. If you know someone who's interested in treatment and has private insurance, they would simply look on the back of their card, their insurance card, for the phone number where they would access treatment.